Please. We already have a quorum. We'll get the meeting started. We are having the meeting over Zoom. When you want to speak, please turn on your camera and show your face. The mics will be turned on only under my direction. And you need to use the backdrop, choosing one of the 3 colors. You can send information to panel HS as the link for your email contact. Since the last meeting, we have issued 6 information papers for your reference. You can find them in the agenda. Discussion items for the next meeting. We have already sent a number of issues to be discussed with the administration. CB bracket for 165/222/01, list of outstanding items for discussion, and CB bracket for 165/2022/02, list of follow-up actions. Our next regular meeting will be held on the 1st of April, Friday at 10:45. The administration suggested that we can discuss the mental hospital item and also other government projects under the first 10-year hospital development plan, because they are not directly related to fighting COVID. Without any objection, we will discuss the above mentioned 2 items at the next meeting. Item 3, measures for the prevention and control of coronavirus disease 2019 in Hong Kong. All members have been invited to participate in our discussion. Can I ask the administration to take us through the paper first in order to conduct the meeting in an orderly manner? We'll remove all the raised hands first. Okay, they have been removed. So for those who would like to speak, please press the raise hand function. Based on a number of raised hands, I will allocate the time to your question and the reply. So let's go to 165/2022/03. Thank you. Dear members, good morning. We have representatives from various government departments, including the Social Welfare Department, Food and Health Bureau, and also Department of Health. We will take you through some updates. Since the outbreak of the 5th wave, positive cases already exceeded 600,000 cases. Omicron is very infectious and it spreads very quickly. And it is truly frightening. The SAR government has mobilized everyone to tackle the 5th wave. It's very strong and vicious, and our focus of work is to reduce death and serious cases and infections through expansion of our hospital treatment capability to, in a concentrated manner, receive COVID cases into the hospitals and focus our resources to save them so that patients will not deteriorate and become serious cases or even deaths. SAR government is very grateful to the central authority for their long-term support for our fight. By the 20th of February, there was an exchange function in Shenzhen, and in a very short period of time, we were able to bring in many health professionals to come to Hong Kong to help fight the 5th wave of COVID. Professor Liang Wannian and the 2 other members of the team also came to Hong Kong, and they have been very busy to make visits at various places, and they have very rich COVID experience, and that's helpful to help the SAR to tackle this unprecedented crisis. With a great support from the central authority, we will be able to support our policy of reductions of infections and serious cases. We will expand the capacity of hospitals. Queen Elizabeth Hospital on the 9th of March has been switched to a designated hospital to treat COVID cases. 1,500 beds have been allocated to receive serious COVID cases. We will concentrate our manpower and resources to take care of the patients so as to tackle the serious wave of virus. On the 13th, or by the 13th, we will also convert or relocate non-COVID patients to other hospitals. We previously announced that Tin Shui Wai Hospital and North Lantau Hospital will be dedicated reception places for COVID cases, and a number of other hospitals will also be converted gradually as designated hospitals for COVID cases. So half of the beds in public hospitals will be converted to receive COVID cases. We are talking about 11,500 in total. Third, we have asked the Mainland Authority to send an expert team to come to Hong Kong to support us. That will help to upgrade our facilities to receive serious cases in North Lantau Hospital at the Infection Center. 816 negative pressure hospital beds, and also at the AWE, we will have more manpower to enhance the capacity. Fourthly, in Lok Ma Chau Loop, we are going to set up an emergency hospital. Mainland team will operate the facility, and within April, by phases, it will be commissioned and begin to provide services. We are also doing triage and multi-tiered treatment, targeting elderly patients. For example, we will set up more isolation and support facilities to the mild cases involving elderly patients. Under medical monitoring, they will recover gradually. For example, at AWE, more than 1,000 beds have been allocated for these purposes. And 2 stadiums on Chau Wing Road and Shek Hin Mei Park have also been commissioned. At the Kai Tak Terminal, 1,200 isolation beds and fostering facilities have also been set up. We will provide more support to disabled homes and elderly homes so that we can have closed loop management. For example, those who have not yet seen any cases, we will enhance protection to them. Thirdly, and provide support to confirmed elderly cases with mild symptoms. They can stay at home. We will provide support kits, and also medical staff will proactively call them to inquire into the health condition so that we could do clinical or distance treatment or diagnosis. Private hospitals are a very important part of our medical system. So we have COVID wards, and they have started receiving COVID cases. And on the 8th of March, the government officials have met with private hospital representatives, urging them to allocate more beds to take on COVID cases. We also recommend them to use different methods to provide medical support to COVID patients so as to alleviate the huge pressure on public hospitals at the moment. We welcome and also expect all private hospitals at this critical time to join in with our efforts to shoulder this responsibility to fight the pandemic and serve the public. In terms of prevention of serious cases, medication is the most important part. The HA has introduced new medication on cases with higher risk of progression. The HA has also procured another plasflobit medication. It is going to be the major method we use to fight the pandemic. We will provide medication early on to infected cases in elderly homes. Other than the measures I've mentioned, we will also continue to step up pandemic fighting measures, detection, tracking, contaminated water tracing, and also vaccination work. I urge everyone in Hong Kong to stay united and work alongside the SAR government. Infection prevention, social distancing are all very important. We'll continue to construct community facilities for isolation, and infected people will be able to enter such facilities so that we can reduce the chances of domestic infection and the spread to other family members. We are certain we will win this battle. Thank you. I have 15 members who are waiting to speak. Michael Chan, Mak Mei Gun, Wang Yun-san, Liang Hei, Regina Ip, Lam Man Gong,朴Hui Fan, Chen Hoi-yin, Yang Wing-kian, Dang Fei, Yeo Pak Leung, Liang Mei-fen, Wang Guo, Lei Wai-king, Lam Chi-yuen. So I hope that we can all be allocated 4 minutes each, question plus answer. Mr. Michael Chan. Thank you, Chairman. Secretary, we have 800,000 elderly people above the age of 70, and within a short period of time, they can't have all 3 vaccinations. They face highest risk. No one knows when the 5th wave will be under control. 20% of people will be subject to infection. That means 160,000 elderly people. We need to procure high efficacy Pfizer oral medication is the most important measure. Liang Mei-fen's brother. Well, if we have this oral medication already available, covering a treatment of 5 days, twice a day, every high-risk confirmed cases will need 10 dosages. So we need 1.6 million dosages. And Mr. Ho Ba-lang also agreed with my calculation. I've followed up on the purchase, and I was told that it will arrive in mid-March, but I don't know how much you have purchased. Why is it such a secret? You're using public money. We have the right to know. From other channels, I know that in March, you will only receive about 100,000 dosages, and in the following months, about 500,000, which is still very far from the target of 1.6 million dosages. So are you saying that 100,000 doses will be sufficient? Secondly, everyone is scrambling for this special medication. I understand that for all mutant strains, it is effective. Have you asked the central authority to help us to procure the medication? Mr. Fan Zheng also said publicly he will respond and help us whatever way he can.
Thank you, Mr. Tan, for your question. First of all, the supply of COVID medicine, we have mainly 2. As I said, first of all, we have 2 kind of medicine, and we can report our situation currently. We place huge emphasis on the purchase of such medicine. The C&I have both written to the pharmaceutical company to allow us to go ahead with our procurement and to have the supplies given to us as soon as possible. The delivery timetable has also been expedited. Secondly, we are starting to distribute medicine in the elderly homes. The CGET team from the under the hospital authority has been working on that. Secretary, I'm not saying that. Mr. Tian, can you let her finish first? We cannot hear her whilst you're sleeping, but she's not answering my question. She is just beating around the bush. Have you requested the central government to give us a helping hand? Otherwise, please let her continue. Well, as I said, the CE and I have been writing to the pharmaceutical companies. Have you requested the central government for help? I want to know whether you have requested the central government to support us. Can you please turn off Mr. Michael Tan's microphone? Secretary, or can we defer to the HA, please? Mr. Tian has mentioned 160,000 elderly, or the oral vaccine right now currently purchased is enough to cater for their needs. Well, Mr. Tan's question is that 100,000 doses may not be enough. He also wants to know when the delivery will be made. Can you tell us whether the delivery has arrived in Hong Kong? And maybe you have over 100,000 doses. Can you try to give us a concise answer on these two questions? HA, please. We have already received their shipment. Patients and elderly residing in nursing homes can use this medicine. The 160,000 elderly mentioned by the Mr. Tian, of course, could be covered by the amount of medicine we have purchased. So gradually you're going to see more shipment, right? Well, yes, currently we do have enough for the elderly, and the shipments would come in phases. Well, you may not be able to give them 10 doses in one go, but perhaps they can start taking them first, and you'll be able to supply them with the other doses later on. Yes, they would come in batches. Next, Ms. Alice Mack. Chairman, I don't think the secretary answered my question, but that's all right. Many people ask why hair salons are able to reopen. How about for nail salons? Nail salons and some beauty salons ask why they're not allowed to reopen. How come only hair salons are able to open? Is that because someone needs a haircut? How can we immediately distribute the oral medicine to the elderly? Many elderly who live in nursing homes already show symptoms. Do we have adequate supply for them? And in December last year, we have seen a report from the central government on a newly researched medicine. Can we also use that as well? I'm also very concerned about the vaccination rate. I have recovered from COVID, and I and my family members have not been vaccinated previously. But then later on, I saw that my father, who is already 85, after 3 doses of vaccine, have only shown mild symptoms. Why can you only take a vaccine after 100 days of recovery? Why can you not reduce the period in between? Right, well, and lastly, on platforms, we do have platforms from both the fire services and the Department of Health. Do we have to report our cases to both platforms? I am sure that you are actually not sure about the numbers, and my number is not there because the Department of Health has not contacted me at all. In terms of social distancing measures, we believe that we cannot relax any social distancing measures at this moment. Some measures relaxed due to essential needs. Yesterday, I have met with doctors from the geriatric department. I do not have the statistics right now, but then the 7 hospital clusters have adequate supply of the oral vaccine. And after assessment, we have already started distributing these medicines to the elderly living in care homes. Thirdly, any new drug can be submitted to the HA for review. As for vaccines, recovered patients on how they can take the vaccine, I think that the Department of Health can answer your question. But then for the vaccination rate of elderly homes, the CSB and the SWD have plans to vax all the elderly within 2 weeks. May I defer to the Department of Health, please? Thank you. On vaccination, we have already discussed it in our committee that those who have been infected would see antibodies. And after research, we have decided on when it would be most suitable for them to take a vaccine. We believe that waiting for 3 months or 6 months would have the best results, especially under the pandemic. With an outbreak in elderly homes, we have reduced the period, but then for regular citizens, they can wait to take their first vaccine after 3 months or 6 months of infection. Chairman, on the 2 platforms, the Department of Health in the last few days set up a platform for the reporting of positive results from rapid antigen tests. After reporting, the Department of Health will then send some people to isolation facilities or ask some people to quarantine at home. The fire services platform is set up to support those in need. For those in need, they can arrange with the fire services department to be sent to isolation facilities, but then the cases would still be referred back to the Department of Health. Yes, the fire services platform is complementary to our platform. When we see positive cases, then we would also arrange for isolation, but then for those with imminent need, they can contact the fire services department platform. Well, 2 members have already asked the same question. Can you let us know in the next few days how many doses of the oral vaccine have you sent out to the elderly homes? We want to see a figure. Next, Dr. Wong Yun-san. Thank you. Good morning, Secretary. I welcome the increasing number of hospital beds made available to COVID patients, but I also want to follow up on the number. We have to calculate the number of positive cases. And then to calculate the number of beds needed, we use the hospitalization rate from Singapore and USA as a reference. figure in USA is 2.7. Well, I chose this number because the vaccination rate of the third dose is similar to us, yet Singapore has a much higher third dose vaccination rate. Therefore, I believe we should use the hospitalization rate of USA, which is 2.7 as a basis. So 2.7 times 1.5 million, we would need around 400,000 hospital beds. But currently, we only have around 24,000 beds, which is not enough. And even if we add up the number for isolation facilities for the elderly, it's still about 5,000 more. So the number doesn't add up. Secretary, do you have plans to increase the number of hospital beds for COVID patients? I think you need an increase of around 10,000, or to enhance the isolation facilities for the elderly. I see that actually in the closed loop, you only have some for imminent need. Can you actually change some of the community facilities into a COVID patient facility, or to become a specified facility for the elderly? Secretary. Thank you, Dr. Wong, for your question. The HA has been increasing the number of hospital beds. So from 3 times the original number, they have now increased to 5 times the number. Tishui Hospital and North Lantau Hospital have both become designated hospitals. And now Queen Elizabeth Hospital has also become a designated hospital. There are also 3 other hospitals that would become dedicated hospitals as well. And of course, there would be a huge increase in the number of hospital beds. We also adopt a triage arrangement. So we would see the tier 1, tier 2 patients, those with emergencies in hospitals. Then for those with more milder systems, then they can go to North Lantau Hospital. They still have negative pressure beds. And then for the lower tier, we do have temporary centers, mainly for the elderly, run by the Social Welfare Department. I understand, but then for the River Loop, can you try to upgrade it to become a designated hospital and not just for isolation facilities? Yes, I understand your concern. Mainly, there are 2 facilities. One is the 1,000 hospital beds, and then for the 10,000 on some mobile cabin hospitals. And we are going to work together to see whether we can enhance the facilities in the Lok Ma Chau Loop. Chairman, perhaps you could see if the HA has any supplement. Well, Chairman, we don't have much to add. The Secretary has already told you about the different tiers. We understand there are many elderly patients, and of course, we hope to put those in hospitals as soon as possible. Those with severe symptoms, we hope we'll be able to put them in hospitals as soon as possible, and will be better operate our hospital beds.
Members, allow me to remind you, when you follow up, normally you will do so before the Secretary has completed her answer, but we are doing online. If you continue on to do that, I will ask the Secretary to turn your mic off so that you cannot intervene. So please help us out. Next is Mr. Leng Hei. Can you hear me? Thank you, Chairman. Thank you, Professor, in early 22, high-risk staff members were offered a daily subsidy, which is 20% of the daily wage or $500 for frontline medical staff who are in the very front line in dealing with the patients directly. But in August last year, the HA said that things got normalized and they decided to stop issuing the subsidies. Now the fifth wave is hitting us very hard in an unprecedented way. And our frontline medical staff are sparing no effort. Can you reinstate the 2 subsidies or allowances right away? HA, what is the latest arrangement? Thank you. Basically, we see the same things. The hardship allowance. Well, we started from the emergency room, and then basically all staff members handling COVID cases will get this special allowance. As for the accommodation subsidy, because there are so many cases in the community, many staff members have been infected as well. We are trying to identify a hotel accommodation for them. So things are already being done. If hotels will offer the accommodation vacancies, you will pay for them, right? Yes, Chairman, yes, we will take up the responsibility. Mr. Leung, anything you want to follow up? Are you going to send out press releases telling us what kind of support is available? Which frontline staff are being supported? I think everyone wants to know. Okay, yes. So you will do that? You will do it, right? Yes, the HA will handle the matter raised by Mr. Leung. No follow-up, okay. Regina Ip, you're next. Thank you, Chair. We can't hear you. You have to repeat again. Can't hear you. Can't hear you. I already unmuted myself. You are breaking up. You have to start again. How about now? Is it better? Chairman, I got complaints from housing estates. A 14-year-old girl tested positive. The father has terminal cancer. They don't go out. They are fully vaccinated. They've been waiting for the government. We have called 4 hotline numbers under the housing department. I think there are many such cases, just like Mr. Leung Kun-yin's brother. So there's a lack of manpower on the government's side. So are you going to consider telemedicine, Chinese, Western medicine, just provide a platform to provide support to the patients? Professor. Mr. Chair, high-risk clusters at home, elderly people, young people, children, pregnant women, etc. We have special support for them on 3 areas. First, under the HA, there is a hotline. You can call the hotline. If you have any medical questions, they can refer you to telemedicine. There are doctors under the HA, they will call you back and see what your problems are. And over the phone, you can do a diagnosis and consultation. And there is another service. Calls will be made by professional nurses to high-risk clusters. And thirdly, there are designated clinics in a closed loop manner they can visit. So those clinics. Yesterday, I talked to the HA. Perhaps we need some sort of triage management to see how we can identify high-risk people who are staying at home. Perhaps they live alone, or there are other risk factors. Then on the one side, without special problems, they can have telemedicine, or they could go to designated clinics or go to isolation facilities. We will arrange these people to be brought to the isolation facilities. Chairman, what the professor said is just things written on paper. In fact, many people have complained they are getting no help. They can't get through the hotlines, or they will tell you the voicemail has already reached its capacity and they can't even leave messages. So what about telemedicine? Well, yes, for these cases, it's possible. There are cases that we can't yet handle, and we welcome referral. If there are difficult cases, we want to deal with them as soon as possible. And secondly, about telemedicine, the HA is already doing that. It's not just about slogans. It's really being implemented every day. There are doctors who will call back those citizens who have called the hotlines if they need consultation or they need questions answered. So, Mrs. Sip, I understand what you are saying. Currently, perhaps we can't satisfy all the cases because a huge number is involved. But we will step up our services to handle more cases. We also welcome other inquiries, and we will deal with them ASAP. Next, Mr. Lemon Kwong. Thank you, Chairman. I have a few questions for the Secretary. First, many people are using rapid tests to confirm the infection, and they will be isolated at home. Perhaps they have received 1 or 2 shots. So in terms of the vaccine pass or further vaccination arrangements, how much time do they need to wait before the next shot? The messages are confusing, and the workplaces do not recognize the rapid test results. Are you going to issue formal guidelines or documentation to give a clear direction? Secondly, about private hospitals and public system, how they coordinate. As we all know, we understand that asking private hospitals to take COVID cases will be difficult in terms of insurance coverage and facilities. But is it possible that under the HA there are 17 dedicated clinics and people can't even get through to make appointments? Can you ask private hospitals to, instead of admitting people, you can do some sort of triage to identify high-risk cases, serious cases, and do referral right away? Can you coordinate better with the private system? Finally, a relevant topic perhaps is not for this bureau. For many CSSA recipient elderly people, they get vouchers to go to public hospitals to see the doctors for free. But now the system can't accommodate them. Can you collaborate with private hospitals and private clinics for these social welfare recipients so that they can get timely treatment or get some medication? Thank you. Professor, Chairman, concerning the rapid test platform, I will ask Mr. Choi, Dr. Choi to respond. Concerning the rapid test registration platform, one of the biggest functions is to identify cases and also to issue isolation orders. Once you register, you upload your ID card and the rapid test photograph, you can receive the order. And the date is provided beginning from registration 14 days. They can use the documentation to make vaccination arrangements. As Mr. Mok said, after infection, we're talking about 3 to 6 month duration in between vaccinations. So with the isolation order, they can prove they have been infected by the virus. We will also make announcements together with the vaccine pass arrangements. As for employers, we urge them to work with us. Once an isolation order has been issued, they should know that the person should be isolated on day 6, day 7. If they get 2 negative results, they can go back to work. And the employer, based on the information provided, should make a flexible arrangements. At least they should realize that this is a legal arrangement for that person to be isolated. I will take the other 2 questions. First, private hospitals. 2 days ago, actually, the chief executive has met with private hospital representatives. I was also there. We have asked them on 4 things. First, we urged them to free up some beds to take over non-COVID cases from the HA. Second, outpatient clinic can receive some patients who may have fever. Not admission, but at least they should be seen. Third, they can help us with community-based isolation facilities because we do need medical staff and temporary care centers. 2 private hospitals have already said that they are willing to mobilize teams to do that. And finally, it's about telemedicine. Some private hospitals have already started that, and we will ask them to do even more. As for CSSA recipients, yes, generally speaking, they will go to the public hospitals. The emergency rooms in the public hospitals are very overwhelmed. But if they have real needs, they can still go to public hospitals. If there are other problems, for example, in terms of domestic isolation, they can call our hotlines. If there is overall risk involved, we will handle them accordingly. I think Mr. Leung's question is about CSSA recipients who normally use public hospitals to receive certain medical services, and they are already terminated or put on hold at the time being. So what will happen to these households? Have you thought about that? Instead of waiting to get really bad, where can they go to be treated? Well, I'll ask HA to look into that. At the moment, for confirmed cases, depending on the situation, I'm asking about CSSA recipients with other conditions. HA, perhaps you can say a few words. I believe you have other outpatient facilities that are still open.
I can only say that we do have some restrictions in terms of manpower because there are many elderly patients. Many non-emergency services have been temporarily suspended. We still provide CSSA recipients or non-CSSA recipients with medicines. We just have to try our best to arrange for the distribution. But how about for outpatient services? Well, yes, it's been reduced. Well, I hope that you'll be able to do more. Well, yes, time is up, so I cannot give you more time. Ms. Elizabeth Kwok. Thank you, Chairman. I have a few questions to follow up. First, on how you handle the corpse, because every day there are many who died from being affected with COVID, and some people have complained that they would have to wait a couple of days before the FEHD could take care of the bodies. So because some of them actually have to be left at home, it's not very hygienic if you have to leave the bodies at home. And the second question is, how many bodies have still not yet been handled, and how many have been accumulated in hospitals? There are many steps and procedures, and now those steps have all been delayed. Some family members worry about the funeral services, even if they have to pay an additional fee of 20,000 to 25,000. Some funeral parlors would still not take their appointments. Would you consider making some funeral parlors a designated funeral parlor so that these COVID bodies could be handled as soon as possible? And many people complain that once the elderly are moved to AWE, then it's like going into a black hole because nobody hears from them. And how can you alleviate the worries of family members and to let them know how the elderly are doing? Thirdly, many confirmed patients only receive wristband and packs from the Department of Health after 14 days. And by that time, they have already recovered. How much does each wristband cost? Would you be wasting public funds if you only send in the wristband after the patients have recovered? The public morgue and the public hospitals and the FEHD attach huge importance to the disposal of bodies, and we are working very hard to handle those in the public morgues. We have already sped up our process. The FEHD has also stepped up with their work in funerals. Well, thirdly, on the question on AWE, I would defer to the HA. Chairman, well, currently we have different halls in the AWE providing different services. One for temporary stay of elderly, run by the SWD, with us providing support. And some beds are used for the recovery of elderly patients. We try to use more of our resources in helping the elderly. As far as I know, our colleagues are working hard in communicating with the family members of the elderly patients, but I can bring this back to them and tell them to relay more information to the family. Well, how long do they have to stay in AWE before they can leave? Well, the average staying time is about 7 days, but then we've heard complaints of having to stay over 20 days. How about the wristband? Chairman, the wristband is part of the anti-pandemic kit. So basically, we would send them to the close contacts and confirmed patients. The ITB will also help us distribute these resource packs and kits. 60,000 such kits have been distributed and delivered yesterday. We are now following up on the backlog. Basically, it's the issue of delivery because some are confirmed and many people are close contacts. Therefore, we have seen a reduction in manpower before. Well, actually, these are all used as souvenirs because by the time the wristbands arrive, the patients have already recovered. How much do these wristbands cost? Well, please supply me with the information. Well, even if you take the wristbands out of the packs, I think it would cost even more money. I don't think you should follow up that closely to that. Well, I just don't want them to waste public money. I really hope that they'll be able to deliver the kits to those in need immediately. Ms. Chan Ho-yen. Thank you, Chairman. I want to know the standards of being confirmed, because previously you said that if you see only one line after being positive for a few days, then it should be deemed recovered. But then with your building is locked down for compulsory testing due to sewage issues, then you will need to do a PCR test, but the PCR test is more sensitive. So if you are tested positive, then you would have to isolate for 14 days. So can you tell us how you interpret being confirmed right now? Because some employers request a negative PCR test before employees can return to work, and this is very confusing to people. Well, now we are trying to minimize deaths and minimize severe cases and minimize infection. Well, how do you do that? Well, the central government has provided us with manpower and the Huen laboratory, but then we are reducing the number of PCR testing labs in Hong Kong. Well, in Shamshui-Po, you see more and more buildings with sewage issues. Why do you not lock down those buildings to conduct mandatory testing? And yes, so we know that you are still able to call through. You said that you're able to call the hotlines and then you still can use the patient call center. But then if that's really true, then there would not be any children fatalities or elderly dying at home. Nobody picks up the lines. You really should try those hotlines. Nobody can call through the hotlines. Thirdly, I'd like to ask the HA, we now really need medical staff to support. But have you asked for COVID to become a vocational disease and to make sure that medical staff could still receive benefits even if they are confirmed positive? First of all, on PCR testing lockdown, on March 7th, we set up a platform that we recognize RAT positive results, and then we would issue a 14-day quarantine order. Or some people may not be very infectious and can return to work. Well, previously, of course, we would recognize a PCR negative result, but we understand that people are not able to conduct a PCR test at home. Therefore, for those who are vaccinated, if you see 2 negative results on 2 consecutive days on day 6 and 7, then the infection rate should be really low. So we believe that the risk is very low for these employees to return to work. So this is how we calculate or look at negative cases. But we understand that some people may have already seen negative results in 2 RATs, but then they are still tested positive with a PCR test. But then when we see such a situation, we still have to consider whether they are still infectious. For those who are still infectious, they should be isolated to minimize the risk. But the PCR test being positive, we would need to look at the CT value. And I believe that we would need to conduct further investigation to ask that person to further isolate and to conduct another PCR test and to test the CT value before we make a decision. Well, but then do we need to extend the quarantine to 14 days? That may not be necessary because from the day of infection to day 8 or day 9, and the CT value is low, even with a PCR positive test, that person will not infect others and thus can leave the isolation facilities. Let me try to answer the other questions. Well, other than minimizing deaths and minimizing severe cases, we also believe that minimizing infection is also equally important. In terms of testing, many laboratories still have a huge backlog, which is not very ideal. We would need to first handle all the backlog. And every day, if you notice, we have increased the number of buildings to be locked down. And there are still backlog in reporting. Therefore, we have relaxed a bit on the compulsory testing, but then we have increased the number of lockdown buildings. In recent days, since we've seen that we actually caught up with a backlog, we decided to open up some mobile testing stations. So for public who would like to take a PCR test, they would find it more convenient. We are looking into building more isolation facilities and at the same time to try to prioritize the elderly. For elderly who stay at home but yet are high risk, we would do our best to arrange for them to be isolated as soon as possible. The hotlines at the HA have been increased to 100 lines. The HA also recruited many medical staff and even medical students to help support our hotline center. We hope we'll be able to handle the needs. I'd like the HA to talk about occupational disease issue. Chairman, well, whether this disease would become a occupational disease is something out of our ambit. I can only say that HA staff who are infected, regardless of whether it is an occupational disease, there is enough insurance to cover the needs of the staff member. Next, Mr. Yang Wing-kit. Thank you, Chairman. Secretary, even if you have increased the hotlines to 100 lines, many people still find it difficult to call through. I hope you would add in more manpower to man the lines. Well, I support QE Hospital becoming a designated hospital. But then I hope that you would consider how to support the patients who actually need to visit the QE outpatient clinics. They do not know where else to go.
Secondly, if you don't want to increase the burden on the public hospitals in terms of repeated consultation, can people just use the slip and approach a local private clinic and then claim the expenses from the government afterwards so that we can reduce the level of inconvenience? Just something for you to think about. Secondly, about isolation arrangements, I got this view from a Hon resident. A 70-year-old man got infected, but other family members are okay because another adult needs to accompany the elderly person, and then 2 children are left at home. What can they do? So there are many unreasonable arrangements. Can you issue some clear guidelines? How do we deal with different situations, different scenarios? We need clear guidelines. Otherwise, there will be a lot of inconvenience caused. You are doing something good, but at the same time, you are causing a lot of pain to people and they feel like you are the bad guy. And then I also have a question to follow up on the issue of measures to obtain antipyretics. But I heard that many private clinics and private hospitals are running out of antipyretics. Can you ask the central authority to procure more antipyretics in mainland China and then transport them to the front line and to other families in need? Because right now, no one is there to deliver any medication and they can't get through on the hotlines. There's a lot of home-based treatment that the government can't really help with. People mainly rely on antipyretics. And what about the COVID oral medication? The government is procuring from MSD and Pfizer. But what about mainland options? There are also available options. Why not procure from mainland China? They can ensure stable supply. They will definitely supply to us. So please consider that as well. Thank you. Your final question, I think Professor Yuri responded to that earlier. Yes, I will be very quick. Concerning the hotlines, we are increasing manpower. We will definitely do our best. And hopefully everyone can be taken care of. I will ask the HA to talk about mid-Kowloon follow-up consultation visits at QE. Thank you. QE has been designated as a COVID hospital. It's a very difficult task. So we are concentrating the experts, infected cases, treatment, etc. There are different buildings involved, and this time we are focusing on the main building, the main block. So for follow-up consultations, for specialist services, they will continue to operate. We will notify the patients the arrangements later on. I will take the other questions, Chairman. Concerning what Mr. Yeo said earlier, if some people who are CSSA recipients and they need to have regular visits at the public hospital, but some hospitals have now been designated as COVID hospitals. And we can arrange under the private-public collaboration scheme these patients to seek help from private doctors. We'll see if the CSSA recipients are already incorporated under the scheme. If not, under these unusual circumstances, the HA will explore viable options. Mr. Young also talked about some elderly people who are at home. They need to be brought to isolation facilities. We do see that under the current arrangement, there are some patients in this category who are not being taken care of. So we need to deal with that. Yesterday, I personally attended a meeting with the HA. We need a system to more clearly state what should people do? Should they just stay home? We provide them with a COVID fighting kit, or do they have to be brought to certain facilities with or without their family members? We will have to follow up. This is one of the major tasks we have to deal with. Finally, medication, antibiotics mainly. If you have been tested positive, you can go to designated clinics. Right now, we can offer antibiotics to these patients. They can also go to general or patient clinic. I've heard from some private doctors, there's a shortage of antibiotics. So the HA and the government are very concerned about this, and we hope to, as soon as possible, talk to the central authority and see how they can help us. Finally, any new kind of medication, whether it's from mainland China or other places, we will keep a close eye on such developments. We will make timely arrangements to make them available to the public if they are effective and they are properly registered. Thank you. Mr. Deng Fei. Thank you, Chair. Yesterday, we had another meeting about disease prevention, but my question was not answered. Mainland doctors providing support to Omicron cases in Hong Kong. Are these mainland doctors scattered around Hong Kong public hospitals? Are they going to be sent to the isolation hospitals or emergency hospitals after they receive in Hong Kong? But they prescribe medicine. Can they prescribe local medicine, or do they have to prescribe mainland medication? If it is the latter, do they have to go through certain legal procedures, exemptions? Then the secretary simply said yesterday that things are being handled. We want to know more details. Professor, do you have any new information? Allow me to explain. First of all, mainland medical professionals. When we look at Hong Kong facilities and the emergency hospital to be built, there will be different arrangements. First of all, of course, at the moment, we have been negotiating with the mainland side. For the medical professionals, they will mainly be concentrated in AWE community treatment facility and also North Lantau Infection Control Center. So far, they will mainly go to these two places. Mainland professionals, especially the second batch clinical experts, have provided a lot of important guidance to us in terms of treatment and also handling COVID cases. So a lot of views have been provided in terms of designated hospitals. So mainly these two places, that's where they will go. When it comes to emergency hospitals, Mrs. Hang asked about the overall treatment mechanism and how medication is prescribed. So initially, they will follow the mainland practice. It will be operated by the mainland professionals. For those who have come to Hong Kong, working at the AWE facility and the center, on a daily basis, we have meetings to see which treatment modality is the best and most helpful to our patients. We have all along been handling that. Of course, there are legal issues involved, but please be rest assured that we will clarify everything. We also have emergency legislation, so I believe that we can handle all the matters appropriately. One follow-up. I want to follow up about the prescription medication. For mainland doctors, they will prescribe mainland medicine, so they will bring the medicine with them. because they're not available in Hong Kong? Chairman, I'm not talking about such details. The emergency hospital is a separate matter. We have to handle that separately. But for AWE and the Infection Control Center, mainly we will use the Hong Kong way of treatment. I have a follow-up question. What about local patients? Under what circumstances will they be triaged to these facilities, and which will be taken to the local facilities? How do you handle the triage? That's a very good question, Chairman. The HA has some dedicated teams to talk to the mainland teams. That is one important topic. Which patients will be taken to the emergency hospital, for example, when they recover? Where will they go, etc.? We have dedicated teams talking about this. So just talking, no decisions yet, right? That's right. We just had a meeting with the Shenzhen authority to talk about these matters. Once you have a decision, provide something in writing to us, please. Next, Mr. Yu Patlo. Thank you, Chairman. Professor, good morning. I agree with the government's current policy. The target should be placed on reducing death, serious cases, and infections. At the moment, we need to protect the elderly and the young. In the community, together with volunteers, we do a lot of elderly care work. We see that especially in public housing estates, there are singletons with many elderly people. They need special support. Do you have any systematic plans to support them? That's the first question. Secondly, what about fighting COVID at home, the support kit? Many practitioners have been helping out in sending out these support kits, but for many confirmed cases and the family members, they need proprietary Chinese medicine, which is not available in the pack. They only have like a mask or thermometers and test kits. Understand that looking forward, you will add the Chinese medicine into the kit, but only one box will be provided. And that is not even enough for one treatment cycle. So will you consider adding another box? What about the wristband? I want to follow up on that. According to what I know, the Innovation Bureau has been sending out more than 10,000 such wristbands. But in terms of connecting them with mobile phones and also hotline inquiries, there's a serious mismatch. So what is the current status of such wristband usage? And I understand that soon the wristband won't be included in the support pack. So are you saying that the wristband is no longer useful? Originally, it is about preventing the spread of the disease internally. Have you come up with better ideas? And what about certification or verification of the delivery people? In some private estates, security measures are very tight, and there are some difficulties in terms of verification of identity. Can you make some staff cards or verification cards, some sort of identification to these people? Okay, there are three areas of questions. First, about how to support the dual loss elderly people, especially those who have been infected.
As I said earlier, we must take care of the elderly. And other than sending them to hospitals and isolation facilities, we are working out a mechanism to allow those who are at home who need support to arrange them to move to isolation facilities. We use a triage to help with the arrangements as we are continuously increasing our hotlines, especially from the end of HA. Designated clinics and the hotlines are trying their best to support the elderly. And we will continue to step up this work. On the Stay Home Safe Scheme pack, yes, we are going to put in Chinese medicine as well. We need to balance out our supply and hope that more people will receive such medicine. Therefore, we would first distribute 1 pack. And some Chinese medicine practitioners have reminded us that such medicines must be used very carefully and should consult Chinese medicine practitioners when in doubt of how to take it. For the wristbands, we understand that some people find it difficult to comply. Therefore, we will not distribute wristbands. However, we will continue to remind everyone that if you are in quarantine, this is actually a legal requirement. The government will issue a quarantine order. The ITB and the Security Bureau will also step up their work to check and verify whether people would still leave their homes without a wristband. And of course, there would be a penalty for violations of the quarantine order. Dr. Cho, we see a very high number of cases right now. Therefore, we must rely on the support of the general public. We understand that some people may not wear the wristbands, and because of the large number of cases, it's hard for us to monitor all. Members of the public will immediately receive the quarantine order once they report it on the online platform. We will, when we first launched the Stay Home Safe scheme, we work with property management offices in distributing support packs. We understand that some management offices are very strict with visitors, and they would help distribute them to the residents. We would try to work out to try to speed up the process of distributing the packs. Dr. Priscilla Leung, Chairman, Secretary. We have received the support from Dr. Gabriel Leung that after the 4th wave or the 5th wave, about 2,008 people would die. So that means that you would see another 2,000 deaths before we would reach this number. In these last couple of weeks, I've heard from friends who have elderly parents and young children that they are worried whether they could overcome the pandemic. So my first question is to ask Secretary that if we're able to reduce the deaths by 25% with a total lockdown, then why would you not consider it? And if you do not want the mild cases to become severe cases, well, some patients know that the medical staff is already working very hard and they thought that they would be able to handle it themselves. But then I have heard many cases in which the mild patients who suddenly turn severe and sent to hospital, and by that time it's already too late. I'm open to both Chinese and Western medicine. I was able to help some of the residents who live in my area. I've given them some medicine because I was able to give them medicine because the whole family was febrile and they tested positive. I gave them some medicine and they recovered. She was very thankful that her daughter recovered and her two sons also became better. So these are the two medicines. So when my family members tested positive, I immediately asked these residents how to use it. And some centers asked whether I could acquire 100 packs of this Lotus capsule for them. But then the SWD workers told me that there must be a shop authorized or verified by the HA before it could be delivered to them. So someone gave me 500 boxes, but then they told me that the Department of Health inspected their offices thinking that they're actually distributing fake medicine. This is my one very important question. Secretary, can you request the CS to invoke the emergencies regulation ordinance to permit the use of this Lotus capsule? Otherwise, we will not be able to save more lives. Can you open this up and allow people to use this medicine? Thank you for your questions. Our main focus right now is to minimize the number of deaths. Dr. Leung and our mainland experts have all given us their valuable comments, and we are trying our best. The HA will step up measures to try to minimize deaths. Well, are you going to impose a total lockdown? Well, let me try to follow up for you. Can you not try to step in when other people are speaking? It's very difficult for me to moderate the meeting. Well, secondly, on cases of elderly and young children, why I know that Dr. Leung has already helped many families. Therefore, we need to set up a system to help those who are not yet supported by our system, yet have imminent need, especially the elderly. At this moment, the HA designated clinics, the patient call center, and hotlines have all stepped up support for those in need. We are trying to iron out details to help the elderly who are staying at home. We also want to try to ensure that mild cases will not become severe cases. If we're able to identify positive cases or high-risk cases early on, then we'll be able to also minimize the risk as well. Of course, we would also use medicine. We can use Chinese medicine and also Western COVID medicine, which has already been distributed to elderly homes. The central government is supporting us, and we are also receiving Chinese medicine from other channels. The Department of Health must ensure the safety of the people, but we also understand that there is urgent need for such medicine. I will, of course, discuss with the CS on how to smooth out these issues. Thank you. Well, as soon as possible, please. Dr. Gabriel Leung said that a total lockdown can reduce the number of deaths. Have you considered doing that, or do you agree with his conclusion? Well, lockdown is just a term. It's just an extreme method of social distancing measures. I hope you agree, Chairman, that we are already carrying out very strict social distancing measures. We will consider it, but as to a total lockdown or extreme lockdown, or after drawing reference from overseas, we believe that we cannot impose a total lockdown because there is still essential need. We would consider whether to step up more stringent social distancing measures. Mr. Lee. Oh, sorry. I made a mistake. It should be Mr. Kingsley Wong first. Mr. Wong, I'm sorry. Thank you. I want to understand whether the government is already doing its best right now, because there are already probably around 500,000 infected people. But then support seems not to be adequate because many people are not able to get through the hotlines, and some are still staying at home, and many delivery now would not come to the door. Would the government consider trying to work like the mainland to try to work in small communities and to ensure that those supply packs could be delivered to those in need as soon as possible, and to ensure that each positive patient could be sent to an isolation facility? Because if you're not able to isolate positive cases as soon as possible, it's very difficult to ensure that those staying at home would be supported. And can you provide both Chinese medicine and Western medicine support, or can NGOs also help deliver supplies to those who are quarantining or isolating at home? Secretary, thank you, Mr. Wong. So you're mainly talking about confirmed cases who are quarantining at home. Yes. In our triage system, a large majority of people who are not able to enter the isolation facilities are actually isolating at home. We would send up supply kits, including information on COVID, thermometers, rapid antigen tests, and to those who are confirmed. And then for people in need, the SWD also has a hotline. And a support hotline, and they can also deliver supplies to those at home. And thirdly, medical support, and that includes a hotline to talk to a medical professional, and there's also the you can call in 1-836-115, and you can also use the patient call hotline. If there's a need, the HA has already increased the number of vaccinated clinics to 17, so they can adopt the closed loop system to visit a doctor and to receive medicine. But for those who do not need to visit such clinics, they can also call in the hotline, and a remote doctor would then call back in. We do have a series of services. We understand that sometimes people are not able to call in. Therefore, we are increasing the number of hotlines and support, and altogether, those staying at home, other than the services I just mentioned, some people would need to move into isolation facilities. They may be healthy, but they may need more support. Therefore, we have to design a system to triage home patients, especially the elderly, those with special needs, and those with more symptoms. Will need to put them in isolation facilities, and we're going to roll this out as soon as possible.
And concerning collaboration between Chinese and Western practitioners or rely more on Chinese medicine, at the moment, we're doing a number of things. First of all, we have central authorities support in relation to allocation of some medication. For example, we have the community-based alliance sending out these medication for us. And then at Penny's Bay, we also have some Chinese treatment and medication. And also every evening for those enclosed or locked down premises, certain Chinese medicine is also incorporated into support packs. Ms. Lee Wai-king, Chairman, based on what the professor said, we have hotlines, elderly people can be triaged, sent in the community, there shouldn't be so much grievances. Professor, you need to understand that you were talking about your goal, but not the facts. Many confirmed patients are getting no help. They can't get through on the hotlines. They can't buy any medication. If they want to call the ambulance, no one will show up. And elderly people who want to meet with doctors, no one is there to see them. Private hospitals reject them. So what you are reporting is not the fact. That is your target only. You haven't done it. You haven't achieved it yet. So back to the hotline. You said repeatedly, just go to the HA will increase manpower. I don't agree with that approach. Frontline staff are already exhausted. Can you provide some WhatsApp hotlines and then do triage? Of course, we should, in the ideal world, have medical staff to respond to hotlines, but we don't have that luxury at the moment. What about elderly homes? I'm really outraged. I've visited many recently. They listened to you. They took back confirmed cases at the end. 80–90% of the people, the elderly people, and also the staff members got infected. Even today, they don't have enough resources. They rely on donation. N95 masks, COVID fighting equipment, still lacking. And then blood oxygen devices, they don't have them. You ask them to fight a battle, but you are providing no facility, no support. People are coming to us all the time. I do appreciate the fact that some of these cases got through. 1,408 elderly people already passed away in such homes. You need to reflect on this. Back then, you asked confirmed patients to return to the homes, leading to this huge death figure. Concerning elderly homes, we have SWD representative to respond. Concerning the support for elderly homes. We do understand at this time the resources and PPE demand is huge. All along, we have been issuing PPE, including masks, eye masks, face masks, gloves, and rapid test kits to them. We also provide special allowances to elderly homes to purchase what they need in terms of PPE or disinfectants or other virus fighting equipment. Such bureaucratic response, even when they have the money, they can't buy those products. Are you helping them? Yes, we have been providing resources to them. I also want to respond to the other question. Madam Lee, thank you very much for reflecting the real situation among our citizens. For confirmed cases, in terms of home-based support, it is not a target. We are doing it at the moment. We also understand that according to what's been said by many members, in terms of the quantity or the overall coverage is not sufficient. We will add to these things. The HA is not the only one doing it at the moment. Various institutions, the nursing school, or the students are helping out to answer the hotline calls. Other than the hotlines, as I mentioned, we have another new measure with triage system so that elderly people at home, they may not need to stay in the beds to prevent mild cases from becoming serious cases. We will provide support to these elderly people, and as soon as possible, we'll place them at the facilities to prevent them from becoming serious cases. And there will be suitable monitoring. So together with HA, we have already discussed how to deal with these cases. We are all very practical and we have real experience. If you have real cases, we welcome them and we will provide support right away. Ms. Lee asked you a number of questions about your targets, whether they have been achieved. So many elderly people died in elderly homes. Is that because of you telling them to go back after they got infected? Next question from Mr. Lam Chi-yuen. Thank you, Chairman. Professor, I have a few questions. First of all, about vaccination, how long you have to wait before the next, or if you are taking the first one. If you are infected, you have recovered, you are in an elderly home, so the first vaccination needs to wait for 90 to 120 days. And then another 180 days before you take the second shot. If I choose the Chinese vaccination, then you have to wait for 360 days before you're fully vaccinated. So that is my first question. What about the elderly care centers? We really need such facilities. For those who got infected from elderly homes, they can be relocated to such care facilities. What is the timetable? When can you complete the relocation exercise? Third question, at these care homes, what kind of level of services are provided? Do you have medical staff doing rounds? Do they have all the medication, all the facilities like oxygen, saline, water? You have talked about the fact that you've been negotiating with the private hospitals. So I feel that they can play more important roles in the pandemic. How many beds are you getting from private hospitals? And what is the percentage to the total number? Next question is about pregnant women and nursing mothers. They really need to be vaccinated around the world and also from local experts. These people need to be vaccinated so as to create benefits for themselves and also their babies? Are you going to promote with greater efforts? What about telemedicine? The demand is huge. So are you going to set up a platform for private and public practitioners to do coordinated telemedicine? If I do it myself, I've been criticized to offer business promotion. So you said 2 questions, but there are 6. Many already responded by the professor. So time is running out. You don't have much time to spend at this meeting. So I will ask Dr. Choi to talk about vaccination and also what the scientists think. Please don't repeat the same answers. Concerning the timing, we have some scientific data, but we will talk to the scientific experts again. For the second question, elderly care centers. This is very pressing. They are operated by the SWD together with some NGOs and some medical service stops. These care centers have been set up in Shek Mei and Chai Wing Road, and at the Kai Tak terminal, there will be another one. We are talked about more than 300 beds, and then 1,200 beds will become available at the terminal. So around next week, sometime next week, they will be commissioned. SWD will have the more accurate number or information. As for medical level of services, they will be operated by the SWD, and one NGO will provide care takers. Different organizations, including the HA, will provide medical practitioners and nurses to provide medical services. It will be rather simple. Medication will be available. Oxygen, yes. Because we're talking about sports stadium, we have to look at the overall situation. So private hospitals, on a daily basis, the HA does report how many people will be transferred to the private hospitals. Private hospitals will provide assistance. They will free up some beds. As for pregnant women and nursing mothers to be vaccinated, yes, I agree with you. We also know that some specialist institutions are strongly promoting that. The Department of Health just promote this. If we need more promotion and publicity, well, we will do more in terms of promotion at the prevention center. When it comes to telemedicine, the chairman of the medical council said telemedicine is fine. On their website, they have also issued Q&As, and many doctors can refer to the frequently asked questions on their website. Thank you. Because 4 members are waiting. Tịch Chi-yuen, Yau Da-gen, Zhou Ho-ding, and Zhang Wen-tong. So when they finish, we will end the meeting. I won't allow other members. So for the second round, well, sorry, there will be no second round.
Dr. Tik Chi-yuen. Thank you, Chairman. Well, we have been calling for help at the elderly homes for over 2 weeks. I'm really disappointed at the meeting today. because I really agree with what Ms. Sari Lee said, and she has expressed all my frustration. Please don't keep on saying what you have done and achieved. If you're able to make achievements, then we really would not be so frustrated today. I don't want to say too much about that any longer. Or can you give some sort of commitment to the elderly homes? First of all, to have the SWD call each and every care home for the elderly and the disabled and children, and to please call them and ask them what they need, because we're not able to reach you at your hotlines. Can you please proactively call them? And for those who need isolation, please do them immediately, because the carers at the elderly homes are not able to help infected patients when they are not infected themselves. So we're not able to do that. You have said that you have increased manpower, you have stepped up your work. Can you promise that you'll be able to do that within a week? Well, it can be temporary or some sort of other isolation facilities. Can you give us an answer how you're going to deploy manpower to help them? And thirdly, to step up vaccination rate as soon as possible. We do have VMO at elderly homes. Can you just vaccinate them as soon as possible and not to wait? Not only for those in elderly homes, for elderly living alone as well. What are your plans to vaccinate all the elderly in Hong Kong as soon as possible? Chairman, I just hope that the government can give us some sort of commitment. I do not want to hear more about what you have done. I just want to see what you are going to commit to do. Secretary, I'll defer to the SWD because they are responsible for elderly homes. Of course, I would also reflect your views to Dr. Law Chi-kwong. No, thank you. Well, thank you for your view. We are going to call every home for the elderly. We understand that each of them have different needs and will provide support as soon as possible. We will follow up. You did mention some sort of a reverse isolation or temporary isolation. We are working on that as well. Please continue. And for vaccinating the elderly, we are putting priority in the elderly homes. We will deploy manpower to do that. In the last 2 weeks, we have already sent out outreach team, and they have increased their capacity by 3 times. And those eligible, we want to ensure that by end of this month, those who are eligible to be vaccinated could be at least given the first dose. Well, I think Dr. Tik is asking for a promise that maybe within a week, you'll be able to send people to elderly homes, to disabled homes, and also to children's homes. I hope that you'll be able to do that within a week. You may not give us an answer today, but please go back and talk to the social welfare department to see whether you're able to visit them within a week and to ask them about their needs and to immediately provide them with the support. Can you provide us in writing on and tell them no whether you could do that? Well, yes, it's no problem at all to contact them within a week. And you're going to follow up on all their needs. Am I correct? Yes, we would do that. Next, Mr. Duncan Chiu. Thank you. I just have 2 quick questions. Some members have asked them already, but I haven't heard a direct answer. Well, first of all, on paracetamol, I have a family, the whole family has fever, and the young child has a fever of over 40 degrees Celsius, and private doctors do not want to see that patient. They're not able to buy any paracetamol anywhere. Can the government actually provide some sort of supplies, because it's really difficult to purchase any out on the streets? Have you considered that, this kind of a simple medicine, how can you provide that to families? And secondly, on the hotline, Ms. Lee has already asked that question. You're never able to get through with the hotline. Legislative counselors, people from different walks of life all want to help those in need. I've already talked to the HA, and it seems that all departments are throwing the balls in other people's court, and they always say that a medical staff has to man the line. So do all the answers need to be answered by someone with medical knowledge? Because some of them are just general knowledge. You can ask other people to help you man the lines, and that can already help you address many of the concerns. Secretary. Well, let me first answer the question on the hotline. There are basically two hotlines. One is for those who are at the stay-at-home stage. So that's under the Home Affairs Bureau, and they take general inquiries. They are providing one extra hotline, and I'm sure they could ask more people to help. And for the other helpline, the 1-836-115 is mainly the HA hotline. And they would be responsible for confirmed cases. Although they may ask general questions, they basically answer medical questions. We have already heard a member's views just now on whether to provide a WhatsApp number. We will go back and look at that. Another question is on families with both elderly and young children, and they need more immediate support. For a young feverish child, the HA has 17 designated clinics that would put priority for those who are 17 and older and those who are 5 and younger. The HA said that most people that you could make an appointment for the clinics, and there are slots available. We have also been talking and discussing with the private clinics, that private clinics and hospitals, I cannot say all, but some of the private doctors have committed to taking in febrile patients. I understand that paracetamol is very important. I understand that there is a shortage of supply at this moment. We are going to discuss this with the central government, and at the same time, at the HA or Department of Health, we're going to do our best to try to provide this in the market as soon as possible. Secretary, well, there are NGOs who hope to purchase some to distribute to those in need, but we're not able to find any. Siu Cafe and I were unable to find any either. So there is a huge shortage of supply. This is not an acceptable answer to us. We really hope that you can come out and tell us that like vegetables, how many catties of vegetables you're going to provide in the market each day, or how many packs of paracetamol you'll be able to put out in the market each day. If you're able to tell them there's enough supply, then people will not just go out blindly and purchase all. You have to ensure that there is enough medicine for everyone. Next, Mr. Holden Chow. I mainly want to raise 2 points. One, on protective gear such as face shields and PPE. Many of the elderly homes are not able to see any such supplies. Would there be some sort of misunderstanding that you're not able to deliver the goods? I hope you'll be able to take a look. I myself, the DAB, we have trying our best to find PPE for the resident or the elderly homes. But if you're not able to effectively provide them with supplies, we're not able to provide them with support. Secondly, Just now, many people have said that can we actually try to isolate the speakers as soon as possible? Well, we have already seen that there are so many elderly people needing isolation facilities. SWD, can you please take this question? Well, actually, we are deploying the supplies and we understand that there is an urgent need. I'd like to thank members for your support of homes of the elderly. We will take note and try to ensure that they have adequate supplies. In terms of increasing isolation facilities, the secretary has already said that we are going to increase the capacity and we would try to speed up the process of arranging the elderly into isolation facilities as soon as possible. Chairman, let me try to supplement. I totally agree that this is very important, and I would personally reflect this back to the Social and Welfare Bureau to ensure that they could distribute the supply of PPE to resident homes as soon as possible. Last, Mr. Chao Man-ki. Thank you. Secretary, I've been trying to contact you for days, mainly on the shortage of supplies. We know that many delegates have sent in supplies to us, but I know that there many NGOs have sent in Chinese medicine, yet it has been seized by the Customs and Excise Department. Well, I understand that they all want the medicines to come into Hong Kong, but then it seems that you're making this impossible. Well, since we've already invoked the emergencies regulation ordinance on February 24th, could you also invoke this ordinance to include the entry of such medicine? I hope you can really help every person in Hong Kong. Although it's not registered under the HA or the Department of Health, can you at least try to use the emergencies ordinance to help this to be allowed for use at this current moment, because many people do have such a need. Well, Secretary, we only have 2 minutes left. Please be quick. Yes, thank you. We are very concerned with this problem. We know that there is such a situation. On one hand, the Department of Health is wants to be cautious and ensure that the medicines are safe for consumption. At the same time, we understand that there is a need. Therefore, we are going to discuss with the CS and to try our best to come up with an appropriate solution. Well, this has dragged on for over 10 days. So how long are you going to continue to drag this on, because we are not able to wait that long? But from the perspective of the general public, the central government has been supporting us with supplies. The over-the-counter Chinese medicine has basically been distributed mainly in the community, and at the same time in the 18 Chinese medicine centers. We're also using that, and every day or night when we impose a lockdown of buildings, then we would also distribute that out in Penny's Bay and also in other isolation facilities. We are also distributing them to need. Well, are you able to distribute everything to like 30,000 people? We will also provide them with anti-pandemic supplies. Well, yes. we can conclude our discussion today. I'd like to thank everyone for attending. Agenda item 4 is AOB. There is no other AOB. The meeting